Sullivan, and I have the distinct pleasure of being the Minister of Health and Community Services in this wonderful province of ours. And I'm certainly happy to be here this morning. It's always a pleasure to be on the west coast of Newfoundland and Labrador, of course. But when we come to make an announcement as significant as this one, it is really a pleasure to be with the Premier, as she will come forward in a few minutes to make the important announcement that we're here to do for this region of the province. And as you know, we have some other people here. Your Minister for the region, the Honourable Tom Marshall, who is the Minister of Natural Resources, and the member for Humber East is here.
And the Attorney General.
And the Attorney General.
And responsible for the Forestry and Agri-Foods Agency.
Minister of Responsible Government. We also have, of course, the CEO of Western Health, Dr. Susan Gillam, and we have Vaughn Granter, who is the MHA for Humber West, with us here today as well. And so it's a big day for us. It's a large day in Corner Brook, as they say. I've heard it's a large day in Labrador many's a time, but it's a large day in Corner Brook today, and I think you're going to agree to that as we get started. So, without keeping you in suspense any longer, I'm going to ask Premier Dunderdale to come to the podium and to outline today's announcement for you. Premier?
Thank you, Minister. Ladies and gentlemen, good morning.
Good morning.
Good morning.
I am absolutely delighted to be here today in beautiful Corner Brook to outline my government's plans to move forward with the construction of a new acute care facility for this region. Making this announcement is a great pleasure, not just because we have a plan for health care in this region and the province as a whole, and not just because this facility represents a long-term vision for health care in this area. Those are critical reasons for this announcement, but for me, this is personally important because it is the fulfillment of a promise our government made to the people of the West Coast, one from which we have never wavered. Today, I'm happy to announce a $227 million investment by this government over the next 3 years to begin construction of a new regional acute care health facility in Corner Brook. Budget 2013 allows us to significantly advance the design of this important infrastructure project, which will provide vital health care services to the residents of the Western region for generations to come. We will start construction on this important project in 2015. Our government has been very focused on making decisions that will ensure we protect our investments for our children and grandchildren so that we do not burden them with extraordinary debt. This has been a challenging process, and we have had to make some difficult decisions as we chart a course for sustainability and prosperity into the future. However, we do not make these decisions in silos. We are very aware of our priorities, and we are continuing to invest accordingly. When we announce in Budget 2013 in the coming days, Newfoundlanders and Labradorians will see our plan for a sustainable future. Over the last 10 years, we have invested significantly to enhance our healthcare system, providing vital services to Newfoundlanders and Labradorians as close to their homes as possible. These investments illustrate a solid plan for revitalization. We will continue to focus on priority areas through Budget 2013. Our investments have resulted in several major healthcare infrastructure projects right here in Corner Brook. These include the Corner Brook Long-Term Care Facility, the Protective Community Residences, Humberwood Addiction Center, and a restorative care unit currently under construction. Our new acute care facility will be a flagship for the region and will enhance the continuum of care in Western Newfoundland that is second to none. Healthcare has been and will continue to be a priority for this government. Since taking office, we have invested $134 million to enhance health care in the Corner Brook region alone through facility upgrades, infrastructure, and new equipment processes. As a result of a strong plan to provide the most comprehensive health care system possible, our government has made tremendous advances in health and social programs across the province since 2003-2004. We currently have the most doctors and nurses working in our province than we've ever had in our history. We have invested over $500 million for a healthcare facility renovations and repairs and capital equipment. We have invested over $140 million to reduce wait times, and that investment is paying off with Newfoundland and Labrador ranking second in the country on national wait times benchmarks. Furthermore, Newfoundland and Labrador ranks the highest in the country for hip replacement and above the national average for knee replacement. None of this happened by accident. We laid out a strong vision for Newfoundland and Labrador, and a solid, sustainable healthcare system is one pillar of our commitment to that vision. We are continuing to build a healthcare system that is responsive and meets the needs of Newfoundlanders and Labradorians. Today, we are taking the next step on that journey. We're going to be calling for proposals on design to close by July. We'll start construction in 2015. We've budgeted approximately $270 million over the next 3 years. The total cost of the hospital will range between $500 and $600 million. So today, as I said, we're taking the next step on the journey, confident that we have the right plan in place to get the right results. Thank you very much.
You know, as the Minister of Community Health and Services and as part of the government of Newfoundland and Labrador, this is a great day for us to be able to come here and make this announcement. And I'm sure it's a great day for you here in the Corner Brook area and in the western portion of the province in general to hear this announcement today. It is something that we're really proud of. And Premier, I want to thank you. The Premier has been dedicated in her steadfastness to see that this facility come to fruition. And so on behalf of everyone here, I'm sure I speak for everyone when I thank you for your dedication to seeing this through and to getting us to this day. I'd like to recognize as well Mayor Greeley, who is here, and the Deputy Mayor, who is also here today, and of course the Chair of our board as well, Tony Gensch, who is here with us today. And I know there are a number of other officials here in the audience, and that too speaks to the importance of this announcement for this area of the province, and certainly we're very happy. So as the Premier mentioned, this new hospital has been a commitment of our government now since it was first announced. And to be able to announce this morning a $227 million investment over the next 3 years to move forward with this vital piece of healthcare infrastructure is a great day for us all. The next phase of the project, as the Premier outlined, which will be funded through Budget 2013, will finalize the design for the new hospital complex, because this is going to be unlike anything that has been seen anywhere else in the province. It will include an acute care center, a separate long-term care building, a mental health facility, and a hostel for our residents and interns, but also for patients and family as well. The project is focused on meeting the healthcare needs in the region while balancing the need to construct in a sustainable and cost-effective manner. And I know, and I want to thank you for your patience, because I know that you've been waiting for this for a while, and we really wanted to take the time to do this right. It has to be the right plan, the right care at the right time. And we needed to take our time to do this. You know, it's the first time in decades that we've built a facility of this magnitude in the province. We need to get it right. And I know as taxpayers, you want to see us get it right. And so we've taken the time, and we're very confident now that we're moving forward with this in the best way possible. The complex will have a total of around 250 beds. The design will finalize all of this for us. an increase from the current existence, the current number of beds that we have. The provincial government will issue a request for proposals for that professional design by July of this year, as the Premier outlined, and that will complete the detailed design of the facility. It is expected that construction will commence on the site in 2015. So now, I would like you to welcome to the podium the Honourable Tom Marshall, Minister of Natural Resources, Attorney General, Minister responsible for agri-foods.
Good day, Susan, Vaughn, the mayor's here, Tony, chair of the board, other councillors are here. You're very welcome. I knew we were getting a hospital. I didn't know we were getting a hospital and a long-term care facility as well. That's great. I mean, long-term care, we're an aging population. We all know that. Our population on the West Coast is declining and it's aging, so we built the long-term care facility. And then the 4 dementia units. Then there's another 14 are under construction right now over at that facility. That'll be 294. And we also know that there's still a lot of acute care beds being taken up by people that need different levels of care. So this certainly will help that as well. There's an acute care center. It's going to be the total package is going to be about 600,000 square feet. An acute care center, the long-term care mental health center. There's going to be an ambulatory building and an outpatients clinic, and the administration building will be there as well. Although I understand that there's still consideration given to using O'Connell for that. There's a central utility plant and logistics, including food services and the laundry, and there's also the hostel for medical residents and for families and patients who will need to take that. So the development will move along. There will be 5 buildings now, and they will move along at, as the minister said, they'll move along at different paces. The design, or the next step is the RFP will go out, as the minister said, and this is just great news. There's a lot of things happening here. There's a lot of potential things that are going to happen here, but above all, we need a facility like this for our children and our grandchildren and our parents and our grandparents, so that they have a level of care that's second to none. And I think this announcement today and the dedication that I see in the Premier and that I've seen for some time, and the as well as the health minister, who don't let her go out with the Israel hand, right? Don't let them take her out. But Israel, you keep her here back and forth making more announcements like this, right?
Well, yeah, some women like the minister would be okay.
Yeah. Again, wonderful news. Thank you, Premier. And I know you're going to be back again with even more news for this area. We'll all be delighted to see it. Thank you.
Thank you, Minister Marshall. And, I should point out as well that the minister's dedication to this district is unparalleled. He does tend to knock on our doors every now and then, 2-3 times a day usually. But you're well served by Tom Marshall and by Von Grenter. So just to give you a little bit more information, today's investment builds on the process that was undertaken by Stantec, a leading engineering management company, to revise the master plan for the replacement of the Western Memorial Regional Hospital. Stantec's process was an important due diligence step that we had to take, and it has had a positive impact on the shape of the new hospital, taking into consideration existing resources and future demand. One of the things that we learned from Stantec, which really took a different approach in terms of how it analyzed the overall need for this region, is that we realized that the first step we need to take is to build that long-term care piece, because we certainly need to ensure that the 25% of our acute care beds that are used now will be freed up to do the kind of acute care work that we need to do in the region. And that was something that Stantec helped us to understand in this whole process of deciding on the way forward and the best way forward. I'll continue to add little tidbits of information that are not on my notes that continue to make people who travel with me really nervous, especially communications people. Most of them would prefer I stuck to my notes, but I've never been able to do that. In any case, I am now going to ask Dr. Susan Gillam, the CEO of Western Health, to come forward and to have a few words with you as well. Dr. Gillam, if you would.
Thank you, Minister Sullivan. Premier Dunderdale, Minister Sullivan, Minister Marshall, MHA Von Granter, Mayor Neville Greeley and councillors from the City of Corner Brook, Mayor Tom O'Brien, Town of Stephenville, and Dr. Tony Ginch, Chair of the Board of Trustees, and members of the Board of Trustees of Western Health, and special guests. It is indeed a pleasure and a great honor to have this opportunity today to bring greetings on behalf of the Board of Trustees, senior executive, physicians, managers, and staff of Western Health. Western Health is always pleased to improve the delivery of health and community services for the people of our region. This announcement today is a wonderful example of that. The need for a new regional hospital in Corner Brook has been a long-standing one, and one that many of the people here today have played a role in and worked towards. We are extremely pleased with this funding announcement today that will ensure the development of a new regional hospital that will be in place to meet the needs of our patients, our friends, our family, and our communities for many years to come. We would like to acknowledge the vision and commitment of Premier Dunderdale, Minister Sullivan, Minister Marshall, and MHA Granter, and the government of Newfoundland and Labrador to make this facility a reality for the people of the province. We are so pleased. As well, the commitment and dedication of the Department of Health and Community Services, the Department of Transportation Works, and other government departments for their vision, commitment, and support as we move forward on this tremendous project. Western Health will continue to work with all of our partners to build a strong foundation for our new regional hospital. The plan for this facility has been strengthened today and will move forward to meet the healthcare needs of the people of Corner Brook and the entire Western region well into the future. Thank you, and it is certainly a privilege and honor and a sincere thank you for this tremendous announcement. Thank you so much.
Thank you so much, Susan. And I'd like to acknowledge Susan's contribution to this as well, particularly as we worked through the planning pieces of this. Susan and her team here at Western Health played a huge role as we did the consultations with them, with the Department of Works, Transportation and Works, through my Department of Health and Community Services. It was truly a collaborative effort to ensure that the facility that we're going to put in place is exactly what responds to the needs of the Western region. This is, and I see some people over there nodding as well who were perhaps part of that team, so I thank you all for that. This truly will be a facility for the Western region of the province. We can't emphasize that enough. We took great care to ensure that when we looked around and we were able to see the investments that have already been made that we can still rely on that contribute to the overall health care of this region. So we looked at Stephenville at Sir Thomas Roddick. We looked at the long-term care facility in Bay St. George. We've looked at all of the facilities in the region to ensure that what we're doing here is taking advantage of all that we have to deliver the best that we can to the whole of the region. I think you're going to be very happy when you see eventually what it is that we're going to show you here this morning as well. So, Premier, I'm assuming that you're going to come over and unveil this for us now, and we'll all take a look. We'll show you what we think it's going to look like. Yeah.
There you go.